Turning now to your community focus, one of the most common types of cancer is also one of the most treatable if it's detected early. We're talking about prostate cancer, and joining me live in studio with more details about that and treatment options that are available to Rhode Islanders is Dr. Elias Hyams with Miriam Hospital's Minimally Invasive Urology Institute. Thanks so much for being here.
Thank you for having me. Appreciate it.
So you are the director of the Institute's prostate cancer program. What are some of the signs and symptoms that people can look out for?
Most of the time, men don't have symptoms of prostate cancer until it's a more advanced cancer in the body. So we do what's called screening, meaning for men, typically between the ages of 50 and 75, we'll test the blood for something called PSA, and the level will tell us about a man's risk.
And is those age ranges some of the people that are highest at risk, or?
Absolutely. So that's the age range where there's the highest incidence of prostate cancer. Younger men can also be at risk, particularly if they have African American descent or have a family history of prostate cancer.
And one of the treatment options is a minimally invasive procedure with some help from robots. How exactly does that work?
Sure. So we do a procedure called robotic prostatectomy. So it's a surgery to remove the prostate using small incisions, and it's much less invasive than traditional ways of doing prostate cancer surgery. We look with a camera and use small instruments to separate out the prostate and remove it from the body. And it's not an automated robot where you might press a button and leave the room. We control a robotic system, and it gives us a lot more precision and dexterity when we do the operation.
For sure. And, you know, prostate cancer has been in the news recently. Defense Secretary Lloyd Austin recently went through surgery for it after his diagnosis, but he had some complications. So how safe and effective is this kind of surgery?
Right. So it's a very safe and actually routine surgery to do for prostate cancer. We do a high volume of these surgeries at Miriam Hospital. Typically, men do extremely well. It's increasingly an ambulatory surgery where men can leave the same day. There's a period of recovery, but men have a very low likelihood of having complications. Secretary Austin had a rare complication where there was some leakage of urine in the abdomen and there was an infection. It's very rare and it's a treatable complication, but yeah.
And earlier we spoke a little bit about screening for prostate cancer. What is your advice to people who might be listening right now?
Yeah, I think it's really important to talk to your primary care doctor about the appropriateness of screening. Certainly men as they get toward age 50 and beyond should really have frank conversations about risk factors and think seriously about having PSA screening.
All right, that's just about all the time we have. Dr. Elias Hyams with Miriam Hospital, thanks so much for being here at 4.
Thank you.